so now we're going to switch gears a little bit and talk about physician communication and collaboration in care teams. And many of us may have been thinking about how care teams can be more effective, but Patricia Sigam from digitalMedLab is here to show us about a platform in a unique area, a chronic wound. And chronic wound is very much related to chronic diseases like vascular disease, diabetes, cancer, and she tells us that up to 4% of the general population suffers from chronic wounds, and it's up to 30% in the nursing home and the nursing care facility population. So digitalMedLab is trying to change this because of the providers that care for these patients. There are a lot of challenges in how they have to care for the patient by going to the place where the patient lives, but then communicating with the rest of their team. So what you have built is an attempt at addressing this challenge.
Okay. Thank you, Grace. So I have 4 minutes to show you what we call the 5-minute wound assessment and documentation. So the idea is you should imagine a nurse visiting a patient home, for example. Here, you can see first a collaborative part. It means it's a part where the team can share some information. This is called the dashboard. It's what the nurse sees when she's using this. One important thing before we start, we have here access to guidelines, and this part can be adapted from every institution to give really the team the access to the institution guidelines. And then this nurse visiting the patient, she have access to the list of all the patients, and she can select the patient. She will have access to the normal information, but what is important for us is she always have a reminder about something which is important, like allergy. She has a possibility to consult the medical history with medication, past medical history. And then she should start to make an assessment. So if she takes the vital parameter, which is not always the fact, she will then have a kind of alert when she gives some measurements that are out of the normal range. So if we come to the specific wounds measurement, what we have developed a solution where she can take a picture, and then she can calibrate with this square the wound, and she has an automated wound measurement system, and she will delimit by herself the wound age, and the machine will give the surface. And what is important for us is that the professional should always keep the control, so if she thinks that the machine is not doing so well, she has a possibility here to update this. So after, she will define all the things about the wound, for example, localization. She can classify the wound. And then she will start the most important part. She can do a description. And what is important for us, it has to be done very quick, so we don't use tip, but we only use scroll down or roll. All this information that she has collected, we use this information to calculate a severity score. And this is a very important screen because when we developed, we didn't realize what we were doing. Because we were thinking, okay, it's important to give a feedback to the nurse with this severity score, but also we have realized that when you show it to the patient, for example, this graph who show the evolution of the severity score is really nice to engage the patient because when they do see like this, they are really interested. Okay, so after she will get some recommendation, she can describe the treatment and send a report to the doctor. And the doctor, he will get such a report. So we can say that WoundDesk brings really value to all the actors involved in wound management. Thank you.
Thank you. You know, what struck me was it's so elegant how it's not simple, the tool, but the experience is simple to use, you know, from how you described it. And I think what it does, though, is so many things. I mean, there's an element, as you can see earlier this morning, we were talking of diagnosis becoming more remote and becoming easier and more distributed. There's an element of classification of the disease in a better way, in a more systematic way. There's an element of communication between the providers, and you even included an element of patient engagement with the score, so that somebody knows, okay, I'm 5 today, and that's not good, I better, you know, get back to 1 or whatever it is. So, you know, all of these dimensions on a mobile platform, I think, is very interesting. So I just would love to get some reactions maybe from Xavi. Yeah.
I love the application. I think that is very useful. But I'm going to change a little bit my questions. What is the business model that are behind this kind of applications? I'm so sorry, because this is a typical...
I like the question,
oh my
because
God.
For us it's really, I'm a physician. So as a physician, I know that it's important not to add so many solutions. So as a physician, I don't want to have 10 solutions. So our business model is to integrate this in existing AHR. And it's what we are doing now at the moment in Switzerland, and it will be integrated in 3 hospitals at the same time, because we are going through the EHR developer. So our customers are mainly providing electronic solution, and we combine these two.
This is my second question: how you can integrate this with the health system? Because sometimes there are a lot of information on this smartphone, but this doesn't go to the clinical for the professional practice. Then it's something that is in the patient's hands, but not on your history on the hospital. Then, if you are trying to integrate, that's a good news.
Yes, our business model is really a white label, completely integrated in existing solution, and it's getting pretty well, because the EHR developer need functionalities, and it's what we offer. We improve the functionality of an existing solution.
Could your platform be used in more than wound care? Because I would imagine taking images could be used in other aspects of dermatology conditions or anything else? Or you're focused on wound?
No, we are open, but it was pretty heavy and tough to develop this application. So now we think that happen what happened, and if we see that the people would like to use it in another setting, it will be great, and we can adapt it to fit different setting. Yes, it will be nice.
Okay, well, wonderful. So an example from Switzerland, and we wish you all the best with it. Thank you so much.
Thank you.
Okay.